Good afternoon, everyone. I'm Kristen Giandoli with Generations Health. Thank you so much for joining us for our program today, Alzheimer's Disease, Stages and Strategies for Care, presented by Jennifer Fitzpatrick. We are so grateful to have Ingleside sponsoring today's program, and in just a moment, I'm going to invite them to join us. But first, there are a few things I want to go over with you. Everyone is muted to eliminate any background noise. However, this is an interactive program, so please feel free to answer questions, ask questions, or if you have any comments on the discussion that is taking place, make them in the chat feature. To use the chat feature, you can scroll over the bottom of your screen and there you'll see a banner that pops up. On the banner, there's a bubble that says chat. When you click on that, the chat feature will launch and will most likely show up on the right-hand side of your screen. When you use the chat, your questions, comments, and answers will only be seen by our sponsor, our presenter, Jennifer, and myself. This is simply for privacy reasons. Again, we encourage your participation, so please use the chat feature. Jennifer is great about keeping an eye on the chat to answer your questions. As I mentioned, we are so grateful to have sponsors for today's program. At this time, I'd like to invite Kirsten Parsons from Ingleside to join me to share a little information with you.
Thank you so much, Kristen, and thank you to each of you for joining us today. Many of you know Ingleside, have maybe visited our community, participate with us in a professional capacity, or looking at our community for a loved one. I am your point of contact for our assisted living level of care, specifically both our memory support neighborhoods and our traditional assisted living. So I just want to introduce you to Ingleside a little further if there are any on this call who are not familiar with our organization. We are a premier provider of senior living services in DC, Maryland, and Virginia. We are a not-for-profit organization. We are what's known as a life plan community. So we do have each level of care: independent living, assisted living, and skilled nursing. We do have 3 communities. As I mentioned, our flagship community is in Northwest DC, Ingleside at Rock Creek. We have our sister community in Prince William County, Virginia, Westminster at Lake Ridge, and our youngest community in Rockville, Maryland, Ingleside at King Farm. One of the things that I want to make you aware of is our opportunity for a respite stay. This is a 30-day stay in our traditional assisted living or memory support assisted living as we have availability. If this is something that would be beneficial to you, if you're traveling and need a safe respite for your loved one while you are abroad, you are welcome to reach out to me. Whatever the situation may be, if we have availability, that's something I can help you pursue. So this is my contact information. Again, it's Kirsten Parsons. That is a cell phone number, so you are welcome to text or call me. And again, I would love to share our communities with you if you've not been out to one of the Ingleside properties before. And if you've got questions about upcoming educational events, if you're a professional and you're looking for a continuing education unit for your credential, or if you're just a family member or a loved one looking to continuously stay informed, please reach out and I'll keep you abreast of what's going on in our communities educationally. So thanks so much, Kristen and Jennifer. I'll pass it off to you.
Thank you so much, Kirsten. We're about to get started, but first I would like to give you a little information about our presenter. Our presenter today is the author of Cruising Through Caregiving, Reducing the Stress of Caring for Your Loved One, and the upcoming book, Customer Service for Healthcare Leaders. Jennifer has also been featured in national media such as Forbes, Redbook, Reader's Digest, U.S. News and World Report, and the Huffington Post. When she's not speaking and writing, she can be found trying to resist the drive-thru at Chick-fil-A or at Macy's looking for a good deal. Please join me in welcoming from Kent Island, Maryland, Jennifer Fitzpatrick.
Welcome, everybody, and thank you so much to Kirsten and the team at Ingleside for putting this family caregiver program on today. Please feel free to write in any questions at all. We want this hour to be about you getting what you need to help your loved one through the stages of Alzheimer's disease. Really briefly, I would like to talk about what is normal. I know sometimes people join these events because they're not quite sure what's going on with their loved one. So I wanted to just give a frame of reference of what's normal and what's not normal. A lot of things change in our bodies as we all find out as we age, and the brain is no different. The brain size shrinks. Our reflex and reaction time diminishes, which you can see when older drivers maybe take a little bit more time to respond to situations on the road. Even seconds, just seconds is a difference in reaction time. We all have something called benign senescence, where we have a mild forgetfulness. Maybe we put down our phone, we can't remember where we put it. We put down our keys, can't remember where they are. We have more tip of the tongue moments. In the middle of the night, actually, I was thinking about a song that was popular a couple years ago, and I was thinking about the artist, and I was thinking about this really is in the middle of the night last night. I was thinking about the artist of the song, and they did this really cool spoof of her song on with her as a guest on Saturday Night Live. And I for some reason it came into my head and I could not remember the name of the artist. And then today at lunch, I just sat there and I said, oh, it was Lizzo. Lizzo was actually one of the guests on Saturday Night Live a couple of years ago, and she did a really funny parody of her song with some of the staff or some of the team members on SNL. But that's a great example of a tip of the tongue moment. I know some people get really worried about that. They get really worked up and, oh, what's wrong? And it happens to all of us, and it does happen more as we get older. Our speed and accuracy of movement does decline as we go through the aging process. We do take more time to learn. And as a college instructor for over 20 years, I can tell you that I've had non-traditional age students and traditional age students. And pretty much always the non-traditional age students sometimes will often take longer on tests. They might also need time to process information before they immediately ask a question. So these are just some of the normal things that happen to us as we get older. So this probably not a red flag. If we can retrace our steps and remember that we had our keys when we were at the grocery store, we had our keys when we went over to the neighbor's house, that is not really a red flag. What becomes a red flag is when we can't retrace. Forgetting something you want to tell somebody about your granddaughter, but you remember it later, not a red flag. Maybe forgetting where your car parked in the gym parking lot. We all do that, not a red flag. New complex financial information or medical information, the first time you hear it, not understanding it, that would not be for most people a red flag. But red flags really look at, you can't remember that there was a pandemic. That would be a red flag. Everybody knows that if their brain is working properly. Some personality changes. You always were very gentlemanly. Now Joe's suddenly using really bad language in front of the grandkids. Thinks Obama is the president, or Reagan is the president, or Trump is the president. So at any rate, just not knowing something that is pretty much common knowledge would be something to be concerned about. Wearing winter clothes in the summer. And before all of you joined us, Kristen and Kirsten and I were lamenting this April rainy weather. But this is a weird time to judge clothing choices, because this is the time of the year, especially on the East Coast, in the Mid-Atlantic area, we don't know what to put on. Do we put on a sweater? Do we wear a coat? Do we not wear a coat? But let's say it's in the heat of the summer, it's a 100-degree day, and your loved one is wearing a big heavy coat or a big sweater, and doesn't seem to realize that that is not appropriate for the weather. So dementia can mean reversible pseudo dementia, that's called, or and actually Kristen, please send me, pseudo dementia should actually be on where it says reversible and temporary. Irreversible is what we're talking about today. It's the dementia that is not going away, that's permanent. So types of dementia, there are many, many types of dementia. Of course, Alzheimer's is the most common one, and that's why we're talking about that today. That's why Ingleside asked about this, this particular topic. But mild cognitive impairment is a term that gets thrown around a lot as it relates to dementia and Alzheimer's. MCI is a decline in executive function, language, memory, and there are some signs of memory loss confusion. And about 80% of people who have MCI do develop Alzheimer's disease within 10 years. So it can either progress or not progress. Most of the time it does. So just a little bit about executive functioning, which of course persons who have Alzheimer's really struggle with. Planning, decision-making, maybe they're trying to plan their errands for the day and they really can't figure out what makes sense, where to stop when. Responding to feedback. Maybe you gave your loved one some information about, something that her granddaughter wants for her birthday, and she gives sort of an odd response. Inhibition is worked upon by executive function, is responsible for inhibition and impulse control. So if we see somebody, we talked about using bad language in front of grandchildren, and maybe they never used bad language before. That would be something that would be a lack of inhibition that we're seeing. We see a lot of examples of that. Maybe somebody that's always been very gracious and polite was telling you that they don't like your hat, and you're really offended, and you're thinking, what is wrong? Why would she say that? That's really mean. And it's just her ability to censor that in her mind is not there anymore. Managing time is a big problem with executive function as well. And so just a little bit more switching and alternating between tasks, starting and stopping a task, trying to figure out a problem. Maybe a flight is delayed, for example. We're seeing a lot of that lately. Maybe a store that they needed something for a recipe is closed, and they're not able to say, oh, okay, well, what will I make instead? So risk benefit analysis. Is it a good idea to do something? What will the consequences potentially be? So Alzheimer's disease is the most common form of dementia. And again, we talked about there's other types. What I do want to say to those of you who are on today and you're not sure what's going on with your loved one, if you're suspicious that there's a dementia, make sure that you're getting your loved one checked out. Encourage them to go to the doctor, because you want to rule out, is this a pseudodementia? Could this be a urinary tract infection that's causing delirium and it's looking like dementia? Is it a nutritional deficiency that we can fix with some vitamins? Is it depression, which sometimes looks a lot like dementia in especially older adults? So the sixth leading cause of death in the United States is Alzheimer's. And there are other types of irreversible: vascular, frontotemporal. There's many types, CJD, Creutzfeldt-Jakob, Lewy body, but this is the sixth leading cause of death, and about 6 million Americans at any given time are impacted by this condition. Learning the language of dementia and learning about dementia, I liken very much to getting around a foreign country. So you'll see here I have 3 flags, and if you've been to any of my dementia programs before, I use this example a lot. I've written about this in my book, Cruising Through Caregiving. If you're interested in the worksheets or a free chapter of the book, you can go to cruisingthroughcaregiving.com, and Kristen can put that in the chat section. But learning the language of dementia in terms of getting around a foreign country, the first one you see is the flag for Ireland. The second one is a flag for Italy, and the last one is for Yemen. So I liken the early stages of Alzheimer's much like going to Ireland without preparation, the mid stages of Alzheimer's as going to the mid stage of Alzheimer's disease unprepared. So if you're going to Italy unprepared, it would be like being with somebody who is mid stage. And then the last one being Yemen. And Yemen likening it to the very late stages of the disease. Now, if you go to the Alzheimer's Association website, if you read certain books, you may see that there are a lot of other scales. And I've seen 7 stages of dementia or Alzheimer's, 7, but I've even seen scales where experts will say there's 10 stages, there's 13 stages. I think it's really simple. It simplifies things for everybody to just say early, middle, and late, but certainly there are other opinions on that. So dementia care, like visiting a foreign country. So if I put you, I know most of our attendees today are from the DC metropolitan area. So I put you on a plane from Dulles or National, and we send you to Ireland, but you haven't prepared. You haven't really looked at what's the weather going to be like. You haven't really looked at, well, what's the culture like, or what are the best places to visit, or where will I stay? What's the food like? If I put you on a plane unprepared, you're going to get there and you're going to be just fine. It's going to be very familiar. It's going to be a lot like the United States. There are differences. They speak with a brogue. They probably drink more Guinness than most of us do. It's greener than the US, but for the most part, you're going to be okay getting around Ireland because there's going to be a lot that is familiar. They speak English. The food will look familiar. That said, you're probably going to have a little bit of an easier time navigating Ireland, and you're probably going to have more fun navigating Ireland is if you do a little preparation ahead of time. You read ahead, you learn what should I visit or what are the people like, and learning a little bit more about that culture will help you feel prepared. And I liken this very much to somebody in the early stages of Alzheimer's, because a lot of times that individual looks and sounds like us for the most part. They have a lot of moments where they don't look and sound like us, but they have a lot of moments where they do look and sound like us. So you see from the slide here, some of the challenges that somebody with Alzheimer's has: struggling with word finding, awareness that something's wrong, losing the ability to retrace steps. I think if anybody out there happening to be watching the show, This Is Us, write in if you're watching This Is Us. There's a character on the show of This Is Us that is dealing with Alzheimer's disease. In fact, she was diagnosed first with MCI, mild cognitive impairment, and then she was actually diagnosed with Alzheimer's disease. Now, I personally think that they're doing a really good job. Not everything is extremely perfectly accurate, but one of the things that I really like about it is that the character, it's Mandy Moore. It's actually amazing. She's playing such a great role. They age her. She plays a young version of herself and an older version, but when she's playing the older version of herself, she's not just unable to communicate. She's having normal conversations with her husband and her adult children, and she's able to do everything everybody else is, but she has moments where she will forget what they're talking about. Or there was an episode where she was filling out a form and she couldn't understand the questions, or she wasn't able to find the right answers for the questions. So the early stages of Alzheimer's disease, the person can look and seem just like us. Now, I was at a speaking engagement once where there was a woman who was in the audience. She saw there was a big screen on the stage with my title of the presentation, my name on it, Fitzpatrick, Jennifer Fitzpatrick. And she, before the presentation, she called me over and she's introduced herself and she said, "Oh, I see that your name is Fitzpatrick. Did you happen to know my friend?" And she went on to say her friend's name, and her friend had the name Fitzpatrick as well. And I said, "Oh, no, I don't. And it's a really common name. And it's my, I guess my married name. So I don't know your friend." Well, have the presentation, go through it, do all the audience questions. And then I walk back into the audience and that same woman calls me over again. And she repeats the exact same story about my name, about her friend Fitzpatrick. And it was really, really fascinating because I have so much experience in this field. But I can tell you that I didn't know she had early stages of Alzheimer's. It turns out that she was actually there accompanied by her husband, and her husband was there to get caregiving information. And I wound up talking to him for a little bit. But of course, I went with the flow. I didn't say, hey, you just told me this story. Don't you remember it was 5 minutes ago? Because I was able to determine that this is somebody that's likely and in her case, it was Alzheimer's disease. The early stages, what we want to be doing is encouraging some sort of assessment, some sort of diagnosis. Again, could it be something that could be treated? Is it a urinary tract infection that's demonstrating these symptoms? Is it a nutritional deficiency? Is it depression? I mean, is there something going on could there be a brain tumor that could be operated on where things get back to normal? So we want to encourage the diagnosis and encourage that person. This can be really hard because a lot of people are in denial. They think it's normal aging. And in this stage, most people they have enough of their faculties that they can say no. And so we have to sort of wait it out with them in some ways. We want to encourage, we want to persuade, but this person still is probably legally competent and considered to have medical capacity at this point. In the early stages, we have to acknowledge to ourselves repeatedly that this person is an adult. This person, your loved one who is demonstrating these signs and symptoms, they're a grown-up still. And while that person is losing their skills and abilities, they are a grown-up. And I have a whole chapter in Cruising Through Caregiving about the concept that your loved one is still an adult. They are still a grown-up. It can be hard to stay with that because so many of us feel, well, a lot of her behavior is becoming increasingly childlike, or it looks more like something that a young person, a child might do. But we have to always treat that person, even though their brain is diminishing in function, we want to treat them like they are a grown-up. Now, other things that are happening in this stage, we see sometimes the beginning of wandering. In fact, on this show, This Is Us, the Mandy Moore character does wander in the beginning before she gets her diagnosis. And the other people that have the early stages of Alzheimer's, the other ways that it shows up, maybe not just in communication, but it might in dress. You might pick that person up to go out for a really nice dinner, and under normal circumstances, they're going to be dressed really well. And you go to pick them up for a really nice dinner. They always dress well, wear makeup, put on jewelry, and they don't have any makeup on, and they have 2 different earrings on maybe, and the clothes that they selected maybe look like they came out of a hamper. And then another day you go to pick them up and they seem dressed fine. They seem like they did okay. So it can be really tough because it's not a straight line. It's lots of ups and downs. We want to encourage in the early stages. One of the best things you can do is encourage your loved one to be proactive about what do they want? What are their wishes? What do they think is important? So if they were ever to need additional care, which if they live long enough with this disease, they are going to need extra care. Do they want to stay home? Would they prefer to go to a community? If they had to go to a community, what type would is there certain activities or geographic area or a religious affiliation that's important to them? Now is the time to talk about advanced directives. If I ever needed a feeding tube, or it was ever suggested, is that something that I'd want? If a doctor ever suggested a ventilator, is that something that I would want? So that, and then also updating wills and trusts and anything that is not any kind of left outstanding types of issues while that person is still legally able to make decisions. So in this stage, people often are trying to reality orient and saying, Mom, you know what, those clothes look dirty. And I think that that's okay in the early stages, because remember, a lot of the time they are like you and I, they are just like us. They have moments where they can function, and that they show up to the door when you come to take them out for a really nice dinner and they're dressed in a beautiful outfit, but then sometimes not. So if you show up at the door and Mom is not dressed in a nice outfit, do you say something? And a lot of families will say, oh, Mom, your earrings are not matched, or, it looks like there's a spot on your shirt. Maybe we should change your shirt. I say that at this stage, it can often be good, because sometimes that person will realize it. Oh, okay, thank you. They want to have that reality orientation, that clarification. I'm of the opinion, and a lot of experts are, that doing reality orientation is probably not productive after the early stages. And we'll talk more about that as we go through the rest of the program. So you can think about it. The big caveat is that if you're reality orienting somebody at any stage, whether it's early, middle, late, and they push back and they argue with you or they get upset, I believe best practice is to just pull back. And we'll talk more about that. So dementia care visiting a foreign country, the mid stages I liken to visiting Italy. So you're going to Italy and you didn't do any research. You've never been, and you don't speak Italian. You didn't download the Italian to English app on your phone. You didn't read anything about the culture, and you're going to Italy, and you're going to a rural part of Italy where they don't speak a whole lot of English. So I put you on the plane at Dulles, and you get over there and you take a car to sort of the more rural Tuscany area, and you're having a little bit of trouble because people don't really speak nearly as much English in the country as they would in the cities like Rome. And in terms of being in this, being in this situation, I think a lot of us feel like, we're going to try to get by, and we feel like it'll be okay, but it really will be more enjoyable. And you're going to feel more confident if you have researched Italy a little bit more ahead of time, especially the towns that you're visiting. But that said, you're going to be okay. You are going to see food that's familiar and delicious food. You're going to see olive oil, and you're going to see tomatoes. I feel like when I went to Italy, some of my favorite things that I ate there, I've never had tomatoes or melons or olive oil as fresh as I did in Italy. The wine isn't too bad either. But in terms of the getting around, you're still going to be okay, even if you don't speak English, you don't speak Italian, and the proprietor at your hotel or your inn is not speaking English. You will be okay. You're going to gesture. They're going to be able to read facial expressions. If you seem confused, or you seem excited, or you seem worried, you'll be able to tell on their face what their expression is saying. And tone of voice. If you took a Romance language in school, which most people did, you will pick up words because there's familiarities with Spanish or French and what have you. So you're going to do okay, but you're going to have more struggles. And I liken this very, very much to visiting somebody or spending time with somebody who has the mid stages of Alzheimer's disease, because there's some moments that they are like us, but a lot more moments where they are not. And so we see more hallucinations and delusions. The person that you love has a harder time understanding you, and you're going to have a harder time understanding them. More challenges with activities of daily living. So you may your loved one, you go to pick them up for the nice dinner, and not only is their clothes dirty and they have 2 different earrings on, and they have makeup smeared on their face. Maybe they smell like they haven't taken a shower. Maybe the clothes not only are dirty, but some of the buttons are not buttoned, or the zippers are not zipped. So harder time. Maybe you go to dinner and the person forgets that they need a fork to eat their meal. And so you might have to cue. So during this stage, you're going to be better prepared and you're going to enjoy your time with your loved one more if you know what to expect. And so this is what you want to be expecting, that there are going to be additional changes. The late stages of Alzheimer's disease, I liken very much to going to Yemen without planning. And if I take you to National Airport, put you on a plane, you're going to Yemen, and you get there and you have not done any research, you will be in very big trouble. Nobody wants to take a trip to Yemen without researching. Now, what do you want to research? So Yemen's very undeveloped. It is extremely different from the United States. Their justice system is different. Their laws are very different. Their dress code, particularly for women, is very, very different. They speak Arabic. There are some people that speak English in other countries and other languages, but primarily every sign will be in Arabic. And that is going to be very hard for you to pick up even if you did take a Romance language in high school, unless you've studied Arabic. So if you haven't researched the culture and the laws and the dress and the language, you are going to be very much at risk. And I really don't think you're going to have a very fun time. Women have very different rights in this country than men do. It is just a very, very, very foreign, very different place. And this is much like visiting and spending time with somebody in the late stages of Alzheimer's. And so the sad, heartbreaking piece of Alzheimer's is that people who have Alzheimer's, and some people live 2 years, 5 years, 10 years, 20 years with Alzheimer's. It really just depends on the person. But people who live with Alzheimer's disease typically are in the late stages, they're going to be bedbound. They are not going to be able to dress themselves at all, let alone put on 2 different earrings, or just not able to zip up or button up. They're not going to be able to do any of that. There's a very, very strong increase of dependence on others. And this is physically taxing. For those of you who are doing it at home, if your loved one is in the early or the mid stage, and you might be saying, okay, we're doing all right, it's coming along, you need to really be prepared for your loved one being more physically dependent. Now, this is important, especially if you're dealing with maybe a 6'2" husband that weighs 250 pounds, and the wife is 5'2" and weighs 110. That's going to be, if she's the one doing most of the caregiving, that's going to be a problem. Getting him to the bathroom, getting him dressed, getting him into a shower, or cleaning him up. What is typically, and of course, the memory is obviously continuously diminishing as you go through these stages. Your memory is constantly being reduced. So the short-term memory in particular, a lot of long-term memory is believed to be intact. But and I think that this is the part that most people, most lay people, most family members get. I get that my loved one doesn't always remember that it's April, and I'm okay with that. But the part about the communication, that when you get to this very late stages, your loved one's ability to use any language is probably going to be gone. A lot of times people in the late stages, they're only communicating with facial expressions, body language, touch. If they want you to come near them, they're going to pull you toward them. If they don't like that they have a blanket on because they're too hot, they might throw the blanket on the floor. If they're still too hot, they might take off their shirt, and it might be in front of their grandchildren, and they don't realize that they're disrobing and that it's not socially appropriate. So the ability to use words is, I think, some of the toughest part for families to deal with, because if you've taken some care of somebody who's sick before, in most cases, that person, depending on what's going on with them, even in the very late stages, up until the last day or two, they can tell us what they need. They can tell us, hey, I'm hungry, I'm tired, I need more medicine, and even if they can't verbally speak, they can write it down. This is this person's brain has regressed so much that they're going to gesture. There's going to be facial expressions. They're going to make noises. They might throw something. So please feel free to write in any questions. What I'd like to invite folks to do is write in at this point, where do you think your loved one is? Would you say early? Would you say middle? Would you say late? And if you're not sure, feel free to write in a question if you would like to figure that out. So I'm going to give everybody a moment to write in. And if you could put in early, middle, or late, or if you want, you could put in Ireland, Italy, Yemen. If you have any questions at all, we're taking questions. We want you to get everything you need out of this program today. So let's talk a little bit more. I'm going to keep the chat open. Please feel free. If you have any, this is your opportunity to ask questions and get clarity. So in this late stage, what we want is, I'm going to just back up for just a moment. In this late stage, what we want is for you to be as educated as possible. And what we want to understand the disease as much as you can. And we also want you to be absolutely sure you're not doing it alone. So maybe you need Kirsten and Ingleside. Maybe you need more friends and family to help you out if you're keeping your loved one at home. Maybe you need some home care aides to help. But the big takeaways, look, I believe that everybody should have a crew of family and friends and neighbors and faith community to help out with every stage, the early, the middle, and the late. But I believe it's the most essential in the late. It is absolutely not possible for one person to do it. So we want you to be educated about the condition, know what's coming, know what you're gonna, what to be prepared for, but also you really want to be able to do is to make sure that you're prepared to have help in whatever form that would be taking. Okay, so we've got some people writing in middle stage. Anybody else, questions, comments? So I want to go through a little bit more of strategy. Again, this is my nephew, Enzo. He is on our boat, and he thinks he's the captain of the boat. He was about 3 years old at this point, and much of the language is going to be that of a small child, okay, for your loved one. And I want to share what Enzo said to my husband, who is the captain of our boat. He came on to the boat that day wearing his hat, and he said to my husband, "I'm the captain." And it reminded me of that Tom Hanks movie. I don't know, I can't remember. This is another example. I'm giving you a tip of the tongue example. But Enzo comes on and he says, "I'm the captain." And do we sit there and get into a big fight with Enzo about, no, you're not the captain? We say, you know what, Uncle Sean is going to steer the boat for a while. And then you're going to help. And a little bit later, as we got out there, Sean let Enzo drive the boat and he loved it. But for all our purposes that day, it really wasn't worth getting into a power struggle with a small child and fighting with him about who the captain is, because he believed he was the captain. That's a task for his parents if he goes home and he thinks he's the captain. But I will tell you that we do see a lot of this behavior with somebody who has advanced dementia. We see the person with dementia is sometimes going to say things that are factually incorrect, like "you're my daughter." A lot of their language is going to be like a small child, like they think "you're my daughter" and you're really their sister, or maybe you're their wife. And this is really tough for a lot of people. But remember that a lot of what's going on is their brain is regressive. It's not functioning as an adult. We want to treat them like an adult, treat them with dignity. We don't want to talk down to them. We don't want to talk baby talk to them. We don't want to infantilize them, but we want to recognize that much like my husband and I didn't want to get into a debate about who the captain was with Enzo that day. We also we also don't want to get into an argument about, no, I'm not your sister, or I'm not your daughter. Again, if the person's in the early stages, you can try it. I just think that, it sometimes they'll say, oh, that's right, you are my sister. But if they push back, just remember, it's probably not worth it. So what do we want to do? We want to validate the feelings behind the words and the actions. So if that person is constantly talking about going home, and I'm sure that Kirsten sees that at Ingleside, I'm sure that a lot of you hear that from your loved ones, even if they are home. Talk about home. Try to find out what kind of home are they thinking about, their childhood home. Be in the moment with them. Validate if they're talking about snow, and we know that we don't have snow today, and they're talking about snow and they're asking about snow. Talk to them about their favorite snow day. Redirecting. If somebody is walking out the front door and we don't want them to because they're going to get lost, they're not going to be safe. Maybe we redirect them to come help us in the kitchen. Maybe we redirect them to take a walk together. Maybe we redirect them to get engaged in some sort of activity like gardening or helping you clean up the kitchen. Engage in preventive activity. One of the reasons that I think that a lot of quote unquote behaviors occur with dementia is because of apathy. That the person is bored. And what we see a lot, especially in private homes, is that the person with dementia is sitting on a couch or sitting in that favorite chair day in and day out, and they're dozing and they're watching TV. And this, think about it, if you are really, I tend to believe that a overly busy schedule is just as bad as a completely empty one. And when we don't have anything on our schedule, I think a lot of us tend to ruminate. And I believe that people with dementia are similar, that they're going to focus on a paranoid delusion that maybe there's somebody hiding in the bathroom, or that they're worried that you're stealing from them. So just because somebody maybe can't dress themselves, or maybe they can't have a conversation about politics, or that they don't know what month it is, it doesn't mean that they can't engage in activities. They could garden, maybe. They can take walks. They can watch old movies. They can dance. They can enjoy listening to music or watching a ball game on television. They might be able to sit down on the floor and play with their grandkids. So, or draw or paint. So this, I think, is pretty stressful thing for a lot of families that have their loved ones at home. And this is one of the reasons that a lot of people do turn, not just for safety, but do turn to senior living like Ingleside, because there is a full calendar of activities that does wonders to prevent a lot of apathy. So do we not want to do? We want to be very careful about correcting. We don't want to argue. And whatever's going on today, and if it's working, that's great. Let's say you're in the early stages with your loved one and you're fine. You all are making out great. And you planning to keep your loved one home for as long as you can, or maybe even forever. I'm happy for you that it's working, but if it doesn't, it might not work forever. Keeping your loved one home forever may not work. Keeping your loved one home may work if you bring in more help, or you get more friends and family and neighbors to help. But whatever is working today, because of the progressive nature of Alzheimer's, it's probably not going to work forever. In the mid and late stages, you're the one that has to be in the moment with them. They cannot, and this is true of the early stages, but in particular in the mid and late stages, they can't have a brain that's not diseased. We have brains that aren't diseased. So we are going to have to be the ones that join their world and educate ourselves. They're not going to be able to relearn what they lost, at least not yet. I'm hopeful someday that we'll find out that maybe there's a treatment that will do that. Know that you can resist power struggles. Don't argue with your loved one. When your loved one says that it's wintertime and you say, no, it's spring, it can never lead to anything good. In Cruising Through Caregiving, I talk about the example about two dudes watching football. My husband and his friend Bill. Bill had just broken up with a girlfriend. Bill and Sean go out, they watch a game. And when Sean gets home, I say, how's Bill doing? And Sean says, fine. And I said, well, how's he doing about the breakup? And he says, I don't know. We didn't talk about it. And I remember thinking, what? If I were there, I would have asked him how he was and asked him if he needed anything. And what happens? That's the former shrink in me. But these were just two guys that just enjoyed each other's company. They didn't need to have a long conversation. And that is how engaging with your loved one often is going to be the most productive, especially in the mid and the late stages. Early stages, a lot of times you're going to be able to have meaningful conversations still. Sometimes in the mid stages, you can also. In the mid and the late, you're really not able to nearly as much as you once were. So be content to be like Sean and Bill, hanging out, doing something together, whether it's artwork, whether it's folding towels, whether it's gardening, whether it's swimming. People who have dementia often can swim, they can walk. In the late stages, not really, but in the early and the mid, activities like that, a lot of people, they might not be able to have a conversation about what's going on with the pandemic or what's going on with your favorite football team, but they can enjoy watching a game with you or doing an activity with you. So a few resources, in addition, of course, to Ingleside, the Area Agency on Aging. If you go to n4a.org, you can find your local Area Agency on Aging. The Alzheimer's Association has all kinds of wonderful, helpful information for you. The 24-hour helpline at the Alzheimer's Association is one of the best resources. I'm not saying that they can fix all of your problems, but there's always someone there to listen. 800-272-3900. And then all the other dementias also have their own associations, but know that the Alzheimer's Association will help anybody and everybody that's dealing with any type of dementia. The last one I wanted to mention is a group that I'm personally involved with on their care advisory board, HFC, the nonprofit for dementia caregivers, started by the actor Seth Rogen and his wife, Lauren Miller Rogen. It's a wonderful charity. They have all kinds of online support groups and programs and grants. So check them out for some more information. And in addition to Cruising Through Caregiving, these are some of my absolute favorite books on dementia. And again, remember, with all the stages, the better prepared you are for the stage, the better educated you are. Not only are you going to be able to handle your loved one better, but anticipate their needs and reduce quote unquote behaviors, but you're also going to be able to enjoy them more. You're going to be able to have more fun together when your expectations are in check. So here's some of my favorite books. Thank you all so very much for joining us today. If you have any questions, we do have some time. I'm going to leave the chat section open while I turn it over to Kirsten to wrap us up and Kristen to after that. So I'm going to turn off my camera, but turn it over to Kirsten, and feel free, if you like, to write in the chat section any additional questions.
Thank you so much, Jennifer. And I know that we've all learned so much from your book, those of us who have read it, and then each time you share with us. So I'm here as well to answer any questions specific to Ingleside, Life Plan Communities, the not-for-profit difference. I can answer anything on that end, and then Jennifer will be with us for about another 10 minutes to answer any questions specifically on what she shared with us today. So thanks so much for joining us.
Thank you, Kirsten. And again, if you have any questions, I do encourage you to write them in the chat, and Jennifer will be happy to hop back on and answer them for you. In the meantime, we're so grateful to have Ingleside sponsoring today's program. And thank you for joining us, and we hope you'll come back and do another webinar with us again. Thank you so much.
I did notice one question in the chat about a CEU event. For those of you who are not a professional holding a license, that is a class that's available for credit for individuals who need to submit that for ongoing education for their credential social work, registered nurses. So we do have an upcoming CEU event this month. So if you put that in the chat, please do email me directly and I can make sure you get the information to register for that event. Jennifer, it looks like we've got a question in the chat.
So, Charlene, my thought about that med that you're mentioning, and I'm going to butcher the, I think it's, I'm going to butcher it. Kirsten, can you say it? Adulam? Is it? I
I
can't.
thought it was Ajum, but we had Melanie Chadwick with us maybe coming up on 6 months ago, and I believe she mentioned it. And so Sherry, I can reach out to you actually with that educational event. It's about 2 hours long, but if you're interested in medications and treatment options, then it's informative, certainly. But go ahead.
Yeah, no, I think that's awesome. So, but what I would say, Charlene, is I think that every single person has to talk all the pros and cons through with their doctor for any drug. And what are the side effects? What are the benefits? I know you're specifically asking me what my perspective is on the Alzheimer's Association supporting it. Oh, Kirsten's giving some more, that Kristen, sorry, is giving some more information about upcoming events in there. So, they have their medical advisors, and whatever their, I don't know their position, to be perfectly frank, what it is, if it's positive or negative, I really don't know. But I do believe that if they, whatever their position is on it, I know they have a lot of medical advisors, they have research folks that I'm sure are looking at what they, if they're, I don't know, again, I don't know if they recommend it or not, but I just think that everybody needs to talk to their prescriber, their doctor. The other thing I would say is if your loved one does choose to go on that drug or any drug, is an overlooked resource is the pharmacist. Because a lot of times the doctor, yes, they know what to prescribe and what makes sense and all that, and they can kind of go through pros and cons with you, do a risk benefit analysis. But I really find that your pharmacist is actually the expert on the drug more so than the doc in some ways. So I know everyone's time with their physician is limited. If you are like, if you do decide, you and your doc decide, okay, mom should take this drug, and you go for it, I would definitely speak to the pharmacist about what their perspective is, what you need to be on the lookout for, because I think that they're a wealth of information. And most of the time, your pharmacist, if they're not busy, they're happy to have a conversation with you. So I just wanted to mention that. But yeah, I just think it's really an individual decision between the patient, the caregiver, and the physician. So any other questions before we log off? And thank you to Kristen for putting in additional Ingleside events with Generations. Also, there's a feedback link. If you'd like to give any feedback on the presentation today, we'd be grateful. All right, well, if there's nothing else, I'm gonna allow Kirsten and Kristen to, Kirsten took her stuff, and then I'll let Kristen wrap us up. I'll hang on for another minute or so and see if anybody writes in, but otherwise, thank you for the opportunity to spend the afternoon with you, and thank you for taking care of your loved one.
Thank you so much, everybody. That concludes our presentation today, and we hope we will see you again soon. Take care.